Introducing the ANS analysis, the analysis of the autonomic nervous system. Like never before, you can scientifically measure your patient's progress, meaning every step of the way you can see if they're improving or if you need to change something. You can do this through an easy-to-use graphical interface on the iPad. The ANS analysis is perfect for acupuncturists, osteopathic physicians, or even medical doctors. Where did it all start? Well, in 1925, Heinrich Herring prophesied that the wise use of the autonomic nervous system will someday represent the core skill in the art of healing. And even before then, Chinese physicians were determining that the pulse has all sorts of capabilities. The ANS analysis is simply utilizing what has already been discovered. The main fields of application include testing for stress and burnout, prevention and risk assessment, and for monitoring therapeutic progress. Testing for stress and burnout. The ANS analysis uncovers stress-induced organic disorders and burnout syndromes at an early stage and visualizes them in a comprehensive, scientific, and easy-to-understand manner. Under normal circumstances, there should be a balance of both sympathetic and parasympathetic tone within the body. These two regulatory systems are measured within the ANS analysis and are shown as a red bar for sympathetic tone, also known as the fight or flight response, and a blue bar for parasympathetic tone, also known as the rest and digest response. The sympathetic and parasympathetic systems are in charge of dozens of vital functions within the body, and it is the relative balance of these two systems which is a critical factor for health maintenance. However, when sympathetic tone dominates for too long of a period, regulatory disorders tend to develop. This can in turn lead to functional disorders, which are medical conditions that impair the normal functioning of a bodily process. This impaired functioning leads to the development of disease such as cardiovascular, metabolic, neurological, psychological, and even infertility disorders. These in turn lead to new stressors and finally into chronic disease states and permanent stress. The modern situation is this: one of overwork, permanent stress, and a high sympathetic tone. It's no wonder approximately 60% of visits to the doctor's office involve stress-related illnesses, and really, what's being done about it? A typical checkup at the doctor's office may include checking for blood sugar, blood parameters, cholesterol, blood pressure, and although this is very valuable, this does not allow the practitioner to draw exact conclusions involving autonomic regulation. The question is this: how many patients with a dysregulated autonomic nervous system go untreated each and every day? We believe far too many. The ANS analysis offers an incredible solution to a problem facing current medical practice and is recommended as part of every patient's checkup and treatment plan. Utilizing the ANS analysis for prevention and risk assessment. When it comes to prevention, the ANS analysis is not a typical stress evaluation. Rather, it shows whether the patient's body is able to handle stress adequately or not. The following fundamental question is answered with the ANS analysis software. Is the body able to decrease the activity of the sympathetic nervous system at rest and increase the parasympathetic nervous system instead? By interpreting this illustration, we can see that the first image shows us a sympathetic nervous system that is overactive, indicated by a red bar in the red range of the graph. Also, the parasympathetic is relatively low, indicated by a blue bar in the red range of the graph as well. We can compare and contrast this first image on the left to the image on the right, which shows an entirely different regulation. As you can clearly see, the red sympathetic bar is in the acceptable green range, and the blue parasympathetic bar is also in the acceptable green range. Regulation disorders often take years to become a visible organic disorder, yet in just 7 minutes, the practitioner and the patient can see if there are any warning signs ahead. Regarding the ANS analysis in clinical practice, Dr. Stephen Borfelt believes there is no other method that detects initiating diseases so easily prior to the appearance of clinical symptoms than the ANS analysis. Monitoring therapeutic progress. The ANS analysis is a powerful tool for measuring therapeutic progress, as it helps practitioners to visualize the effects of applied therapies as they relate to the body's entire regulation, easily and precisely. Whether you practice conventional medicine, integrative medicine, dietary approaches, complementary medicine, or even prescribe specific at-home training for patients themselves, you can confidently track the progress of these methods with each new patient. Let's now take a look at administering the ANS analysis in practice and then interpreting the results. The ANS analysis is administered quickly and easily by a practitioner or trained assistant. All that is required to perform the test is a basic heart rate monitor attached to a chest strap. Clothing can remain on as long as solid skin contact is being made. For women, the strap fits conveniently below the bra area. The recording should take place at rest while sitting or lying, although no talking or moving is required. The measurement period will last for approximately 7 minutes and afterwards is instantly illustrated as an easy-to-interpret diagram. Using the information gathered, the practitioner will be able to confidently assess risk factors and determine future therapeutic progress. Interpreting the recording so patients understand is quick and easy. The reading ahead can be explained to the patient in an easy-to-understand manner, and in this particular instance, the patient's regulation is impaired, as the sympathetic and parasympathetic are both out of the green range, indicating a regulation disorder. In addition to the simple patient view, let's take a look at some of the other data that was gathered during the recording process. There is also a practitioner view within the ANS analysis that offers us an even more detailed assessment of a patient's autonomic functioning. The first bar, colored purple, shows the median heart rate during the recording period. The second bar, colored green, is our alpha-1 parameter. This so-called nonlinear parameter is based on fractal geometry and is used in risk assessment for cardiac events such as sudden cardiac death. Numerous studies have proven that a permanent impaired regulation to the ANS contributes to lower life expectancy. The third bar, colored orange, is our SDNN value, or standard deviation, normal to normal. It represents a median of the variability and consists of sympathetic and parasympathetic parts. Therefore, this represents overall variability. The fourth bar, in red, is our stress index, also known as sympathetic activity. The fifth bar, in blue, is the root mean square of successive differences, and it represents the parasympathetic activity calculated from beat-to-beat variability. Let's now take a look at the rhythmogram portion of the analysis to get a better understanding of heart rate variability. In the rhythmogram, the heart rate variability, or HRV, is recorded in milliseconds. The more irregular or jagged the rhythmogram, the better the variability. Variability simply means adaptability of the organism, or parasympathetic nervous system is dominant. The straighter the line in the rhythmogram, the worse the variability, or the sympathetic nervous system is dominant. Let's explore heart rate variability a bit further because it's a very important concept. The ANS analysis measures heart rate variability, or rather the beat between each subsequent heartbeat. Because the sinoatrial node of the heart is permanently modulated or influenced by sympathetic and parasympathetic stimuli, the heart serves as an effector organ to determine exactly the regulatory state of the sympathetic and parasympathetic system. The variability of the heartbeat is therefore an expression of the permanent adaptation of the heart by the autonomic nervous system. The greater the variability from one heartbeat to the following, the greater the parasympathetic activity, and the better the adaptability of the organism to internal and to external stimuli. As Darwin once said, it is not the strongest or most intelligent species that survives, but the one most adaptable to change. In line with the motto, "A picture is worth 1,000 words," the ANS analysis interprets a highly complex subject such as the autonomic nervous system in a way practitioners and patients can easily understand. Improving parasympathetic activity. Proper functioning of the vagus nerve is essential to your health. Numerous studies from around the globe have confirmed that therapies with strengthened vagal tone and increased parasympathetic activity are important for physiological regulation by the ANS. Given the vast data supporting these studies, It appeared to us that respiration is the ideal foundation for a gentle, fast, yet effective therapy that strengthens the ANS and especially the vagus nerve. For these reasons, respiratory therapy is integrated into the ANS analysis professional software and can be used therapeutically. Paced respiration at a rate of 6 beats per minute with an inhalation of 4 seconds and an exhalation of 6 seconds is a highly recommended protocol, as healthy patients show the maximum heart rate variability at this frequency. This is because the rhythm of the heart can be influenced by a guided rhythmic respiration. In case the first measurement reveals a regulatory disorder, that is increased sympathetic and decreased parasympathetic tone, a second measurement under paced respiration should be performed immediately afterwards. The practitioner should notice during the measurement whether the variability and therefore the parasympathetic activity increases, or whether the patient has a blocked regulation. After the breathing test is complete, the practitioner can now compare the previous analysis, showing the regulation disorder, to the new one with the applied respiratory therapy. In this case, the patient has shown increased parasympathetic activity. This is a positive therapeutic sign and is recommended that the patient starts a regimen of respiratory therapy with vagus fit. This cardiorespiratory biofeedback should be performed regularly for approximately 30 days. Afterwards, there should be another measurement with the ANS analysis to check the patient progress. Up to this point, we have demonstrated how valuable the ANS analysis is for clinical practice, specifically when testing for stress and burnout, assessing risk profiles, and when monitoring the progress of therapies. Let's take a look at some of the proven studies and research the ANS analysis is based upon, and then explore specific patient case studies. To date, nearly 20,000 studies have been published regarding heart rate variability. The ANS analysis incorporates the normal values of the most important global reference studies and is the result of a 10-year research period by one of the most renowned German heart rate variability experts. Heart rate variability is applicable in nearly all specialist divisions by a wide range of practitioners, such as in general medicine during checkups, pregnancy and hormonal disorders, risk identification and cardiology, burnout and depression, tinnitus and vertigo, erectile dysfunction, pain syndromes, diabetic neuropathy, and is used in prevention by detecting disease precursors. Let's take a look at specific case studies via the ANS analysis to get a further view of its applications. Case studies via the ANS analysis. This case is a 51-year-old patient who presents with high stress, incipient metabolic syndrome, and inflammation of the left shoulder. The analysis reveals a high sympathetic and a low parasympathetic tone out of the green range. A protocol of intravenous oxygen therapy as well as dietary change has been prescribed as a course of treatment. Afterwards, the analysis reveals that the functioning of the autonomic nervous system has been restored. This case is of a 49-year-old patient who presents with stress, incipient hypertension, as well as tinnitus. A disproportionate sympathetic and parasympathetic lead the physician to prescribe intravenous oxygen therapy as a treatment protocol. Afterwards, there is a significant improvement in autonomic regulation, as well as a return to normal blood pressure, and the tinnitus has resolved. This case study is of a 36-year-old patient with high stress who suffers from migraine headaches complicated with nausea and vomiting. The ANS analysis reveals a regulatory disorder, and the physician prescribes acupuncture and respiratory therapy. After 2 weeks of conventional acupuncture treatment and daily guided respiratory breathing with vagus fit, the patient's sympathetic tone has decreased, migraine symptoms have diminished considerably, and the parasympathetic has been moderately improved. We can interpret this case study via our practitioner view, which will allow a more in-depth analysis. The rhythmogram shows an impaired regulation as the heart rate is not variable. This is also mirrored in the bar graph and scatter plot. The analysis is from a 58-year-old patient who is obese as well as hypertensive. Controlled breathing was administered, however the patient showed no positive parasympathetic reaction. The physician then prescribed a beta blocker which also showed no significant effect on the patient's regulation. This patient's regulatory capabilities are therefore impaired. In this particular case, the patient presents with lower back pain and is prescribed a treatment protocol of conventional acupuncture along the body, as well as auricular style. Additionally, interstitial laser acupuncture is performed along the lumbar spine. This course of treatment was for 3 months, and the improvement was dramatic, showing significant improvement in autonomic functioning as compared to the prior analysis. This patient presents with migraine headaches. The analysis detects high sympathetic tone, nearly in the red range, and very low parasympathetic activity. Acupuncture is prescribed with points such as pericardium 6 and heart 7. Also, an application of red laser, continuous wave for 20 minutes. This therapy was applied over a course of 3 months and showed a significant reduction in sympathetic tone, bringing it back into the green range, as well as a considerable increase in parasympathetic activity and an overall increase in median heart rate variability. And finally, this patient was treated with classical needle acupuncture along the body and ear, as well as laser style, which was administered for 30 minutes. This course of therapy was conducted over a 6-month period and resulted in a decreased average heart rate, increase in median variability, and a complete recovery of autonomic functionality. These case studies demonstrate just how easy it can be to measure your patient's progress, and allows you to take the guesswork out of your practice. Choosing which system is right for your practice. The ANS analysis offers 3 different systems to choose from. The ANS analysis standard is our entry into the ANS analysis. It includes the parameter of heart rate variability with rhythmogram, histogram, and scatterplot. Parameters such as pulse, standard deviation, sympathetic and parasympathetic tone guarantee a fast and easy evaluation. The standard version was developed for users that are looking for fast and easy to interpret measurement results. The professional version has been specifically designed for use in therapeutic practice. It is ideal for prevention, checkups, therapy, and progress monitoring. The 2 different viewing options, patient and practitioner, allow the possibility to explain the regulatory capacity of the autonomic nervous system in a fast and easy way to patients. In the practitioner view, the alpha 1, which is the green bar, plays an important role as it captures the quality of the regulation and offers a high additional value as it can be used as a risk parameter for cardiac events. You can also dispatch measurement results to patients via email or print and PDF functions. Our integrated respiratory therapy is also included, which can be used for immediate stimulation of the parasympathetic nervous system. Also included in the professional version are shorter measurements, normal values for athletes, as well as a statistics function. The Professional Plus version includes all of the features of our professional version, but is complemented by an increase of personalized service, such as in-person practitioner and staff training, and marketing and education material for patients. The ANS Analysis Professional Plus fits the demands of 21st century medical practice, combining the benefits of a scientific analytical instrument with a revenue-generating practice tool. The marketing material provided has been specifically developed to increase patient interest in the analysis of the autonomic nervous system, helping to support you and your staff while educating the patient towards the many benefits of continued testing. Our software has been designed with the busy professional in mind. From uncomplicated email dispatch to expert support via telephone, we make life and work easier for you and your staff. The training courses on-site provide a key to successful marketing and a high patient acceptance of the ANS analysis. The most important goals in the training process are to provide competence towards getting the patient interested in the ANS analysis and incorporated within their preventative health routine. To find out more information about the ANS analysis and to learn about pricing and financing options, please visit us on the internet at www.ans-analysis.com. Thanks for watching.